Imagine a disease that can turn something as simple as a scratch or a mosquito bite into something dangerous. A disease that can affect the heart, cause bleeding, bone pain, and even lead to death. Welcome to the world of scurvy, a disease that, despite its rarity today, can still be fatal and has a potentially worrying resurgence with the popularity of trendy and restrictive diets. We often think of scurvy as a disease of the past, something that the crew of old ships would have to deal with. But today, in a world where restrictive and trendy diets are becoming increasingly common, scurvy is finding a new generation of vulnerable people. Throughout this video, we will understand what scurvy is, its symptoms, and why even in a world full of fruits and vitamins it is still a threat. In addition, we will analyze the role that restrictive and trendy diets play in its resurgence and the dangers it poses to our. If you like this content and want to see more about health, nutrition, and well-being, don't forget to subscribe to the channel and activate notifications so you don't miss any new video. Share this video with your friends and family. Brief history of scurvy. Scurvy has been a known disease for centuries, with reports dating back to ancient civilizations such as the Egyptians, Greeks, and Romans. However, its importance began to be recognized in the 16th and 17th centuries, when long-distance sea voyages became more common. During exploration voyages, scurvy became a serious problem, with entire crews suffering from the symptoms of the disease. It was only in 1747 that the British surgeon James Lind conducted an experiment that revealed the link between the consumption of citrus fruits and the prevention of scurvy, and the use of lemons and oranges on British ships began to be implemented. Modern world scurvy and the impact of restrictive diets. In the modern world, scurvy is considered rare in developed areas, where diets are varied and rich in fruits and vegetables. However, the resurgence of scurvy has become a concern, especially among those who adopt restrictive diets. Fad diets often emphasize the elimination of entire food groups or severely restrict the intake of certain nutrients, including vitamin C. This can result in nutritional deficiencies and eventually lead to scurvy. For example, the carnivore fad diet consists mainly of meat and animal products, with little or no intake of fruits, vegetables, or whole grains. While the keto diet reduces carbohydrates, it can restrict sources of vitamin C, such as fruits and vegetables, depending on its variety. Furthermore, fad diets like the paleo and warrior diet can also restrict the consumption of fresh fruits and vegetables, which are important sources of vitamin C. These diets, when followed improperly or for a long period, can result in vitamin C deficiency and eventually scurvy. There are also concerns about restrictive diets that follow specific religious or cultural patterns, which may exclude or limit certain vitamin C-rich foods, such as fruits and vegetables. For example, some vegetarian and vegan diets may completely exclude the consumption of animal products, which are important sources of vitamin C, such as meat and dairy. Furthermore, people who have difficulty accessing fresh and varied foods, such as those living in areas with limited access to food markets or with limited income, may also be at risk of vitamin C deficiency and scurvy. Therefore, it is important to recognize that even in a world with an abundance of food, scurvy can still be a threat, especially among those who follow restrictive diets or have difficulty accessing fresh and varied foods. Education about the importance of a balanced and varied diet is essential to prevent vitamin C deficiency and scurvy. Symptoms of scurvy. The symptoms of scurvy can begin to manifest within a few weeks to months of severe vitamin C deficiency. Initially, the symptoms are nonspecific, such as fatigue and irritability, but can evolve into more characteristic signs. One of the first symptoms is inflammation and bleeding of the gums. Bleeding can occur around the teeth, and it can be spontaneous or result from small wounds. As the disease progresses, bleeding can also occur in other areas of the body, such as the skin, nose, and even the eyes. The skin may become dry, rough, and discolored, and wounds may have difficulty healing. In severe cases, there may be bleeding in the eyes, causing vision loss. There may also be bleeding in the mucous membranes, such as nasal or rectal bleeding. Other symptoms include muscle pain, sore and swollen joints, weakness, swelling in the legs, bruising under the skin, headaches, hair loss, yellow skin and eyes, and bleeding in the joints. Additionally, the person may feel tired, depressed, and unmotivated. The symptoms of scurvy can resemble other health problems, which can make diagnosis challenging. Therefore, dangers of scurvy to the body. Scurvy, if left untreated, can lead to serious complications and even death. Vitamin C deficiency affects collagen synthesis, which is important for wound healing and proper functioning of blood vessels. This can result in nosebleeds, gum bleeds, and even internal bleeding. In addition, vitamin C deficiency can affect the immune system, making the body more susceptible to infections. This can lead to frequent infections, slow wound healing, and a higher chance of developing complications. The lack of vitamin C can also lead to muscle and joint pain, weakness, fatigue, and anemia. Anemia occurs when the body does not have enough healthy red blood cells to carry oxygen to the body's tissues and organs. This can cause symptoms such as fatigue, weakness, paleness, and shortness of breath. Furthermore, vitamin C deficiency can affect oral health, causing gingivitis, gum inflammation, and periodontitis, a severe disease that damages the supporting tissues of the tooth. Therefore, it is crucial to consume foods rich in vitamin C or take vitamin supplements to avoid vitamin C deficiency and the development of scurvy. It is important to seek medical advice if you suspect a vitamin C deficiency or scurvy, especially if you are following a restrictive diet. Always remember, taking care of your health is essential for living a full and healthy life. In conclusion, scurvy is a disease that, despite its rarity today, still poses a danger, especially for those who follow restrictive diets. The symptoms of scurvy can easily be confused with other health problems, which makes diagnosis challenging. It is important to seek Now that you have learned about scurvy and the dangers of restrictive diets, don't forget to subscribe to the channel for more information about health and nutrition. Learn how to balance your diet and adopt healthy habits that promote long-term well-being.